spring, and I'll let Dr. Dixon and others speak specifically to that. This will be ready to start taking patients on Sunday. It came together with the help of, obviously, UMass Memorial Medical Center, the folks at MEMA, the National Guard, and many others, and obviously we're enormously grateful for all of the work that people put into getting us here today. In a minute I'll talk a little bit about the field hospital itself, but I'm going to start with the daily update on COVID-19 and the public health metrics. Yesterday the Department of Public Health reported 4,613 new cases. That's a very significant number of new cases, but it also sits on a very big number of new tests, which was 105,000. In total, over 8.5 million tests have been conducted here in the Commonwealth, and the 7-day positive test rate is 4.9%. As the folks at UMass Memorial here in Worcester know, we've seen a continued increase in hospitalizations, slow but steady, since Labor Day, both here in Massachusetts and around the country. Statewide, just over 1,250 people are hospitalized, with 264 people in the ICU. The new case growth is obviously driving a rise in hospitalizations, and on average, hospitalizations have been growing at about 2 to 3% per day for the past couple of weeks. The good news is that medical professionals have gotten a lot smarter and a lot better about treating people who are dealing with COVID. That means outcomes have improved and fewer people are requiring intensive care, ventilators, and intubation. And the ratio of people in the ICU to the total number of people hospitalized is down significantly from what we saw back in the spring. Still, obviously, as cases rise, we can expect our hospitals to continue to face additional strain on the system. And the Commonwealth's hospitals, as everybody knows, have done a tremendous job working through this pandemic, dating all the way back to last March, from, in many respects, the most difficult days of that surge through the summer and now into this fall surge. And hospitals are continuing to increase their ICU capacity across the Commonwealth, and we need to do everything we can to support them. Which brings me to today's purpose here at the DCU in Worcester. Field hospitals play a critical role in our preparedness strategy that help us alleviate pressure on the healthcare system generally and enable hospitals to focus on non-COVID patients. Standing up a facility like this requires tremendous collaborations from a number of stakeholders, and we're very grateful for everyone's commitment to make this one come together. UMass Memorial Hospital is our key clinical partner on this site. They're responsible for the medical build-out, the pharmacy, the medical supplies, and the patient management IT system. And I do want to thank Eric again and his incredible team for all of their work all the way through this, all the way back to March, and for their dedication to the people they serve here in central Massachusetts. MEMA obviously coordinated a lot of the logistics and construction of the site. I asked Sam Phillips, who's the head of MEMA, if she just sort of reached into her closet and pulled out a lot of the stuff she had left from last spring. The logistical effort to build this out was supported by a team of about 200 people, which included approximately 20 staff from MEMA, about 40 or 50 National Guard personnel. Where's General Keith? There you are. Thank you, sir. I say all the time that when you call the Guard, they come. They're the only people I know from whom that's true 100% of the time. And approximately 80 other contractors throughout the setup period, electricians, plumbers, laborers, and DCU staff. I just want to say thanks again to all of those who've been involved in putting this up. The build-out obviously required a significant amount of equipment as well, more than 6,000 feet of electrical cable, more than 8,000 feet of pipe and drape, 45 hand sanitizer stations, 400 chairs, 80 tables. It's a lot, and it's significantly more with respect to its capacity to serve than it was last spring, because people were able to apply a lot of the lessons from what we learned last spring into this particular effort as part of this second surge. The space also has unique flexing capability and can accommodate about 220 patients at full capacity. The staffing plan is also flexible and can be modified by the medical director as needed going forward. Today we're also announcing that the state will be launching a second field hospital in Lowell. It'll be stood up in the coming weeks, and we'll have more details on that one soon. And we look forward to working with Lowell General Hospital as our clinical partner once again on that one. And before I close, I do want to once again thank everybody here in Worcester for this incredible effort. MEMA, the Guard, the DCU Center, and especially UMass Memorial, and the dedicated healthcare workers who will staff this facility going forward. We are all deeply grateful for all the work you've done stepping up over the course of the past 10 months to fight COVID with us here in the Commonwealth. I do want to close by pointing out that there is some reason for optimism given all the news we've been hearing about vaccines over the past few days, but there's still much work ahead to stop the spread of COVID from infecting more people here in Massachusetts. The Commonwealth, like many other states, is preparing our distribution effort with respect to vaccines, so we'll be ready to work with our partners to distribute them at the appropriate time. And progress on this does not mean, however, that we are able to flip the switch and suddenly return to normal. People need to stay vigilant, and they need to keep doing the things that we know keep the virus in check. Wearing face coverings, avoiding groups, keeping our distance, staying for the most part with the people that we live with. These are all important elements of how we continue to deal with the spread. Obviously, the numbers that were reported yesterday indicate that we have community transmission across the Commonwealth, and it's incumbent on all of us to recognize and understand that and to do the things that we need to do to keep ourselves, our loved ones, and our co-workers as safe as we possibly can. Obviously, all options here remain on the table, but we do believe that with the help of every resident of Massachusetts, we continue to do the things that reduce the spread here in the Commonwealth. We will be issuing today another alert to residents across the state, and the goal is to remind people that community-wide spread is happening in their towns and that we all need to take the steps to protect our family and our neighbors. That alert will go out via text, voicemail, and email to residents across the state later today. We're planning to keep that effort up in the coming weeks and months to continue to remind people that they need to stay vigilant so that we can stop the spread. It's up to everybody to do their part with respect to this, and the virus is not going to go away anytime soon. And with that, I'll turn it over to the Lieutenant Governor.
Thank you, Governor, and good morning, everyone. I want to start by acknowledging that this is a tough time of year for us in Worcester. 21 years ago today, we lost 6 of our firefighters on the Worcester Fire Department. And that was heard not only across the Commonwealth, but in places across our country. We will always remember the Worcester 6. We will always remember their families, Spencer, Jackson, Lyons, Lucy, Brotherton, and McGurk. A year ago, we lost another firefighter in Lieutenant Menard in November. And 2 years ago, in December, we lost firefighter Christopher Roy and John Davies. We think about that a lot this time of year. And I just ask that all of you remember them in your prayers, their families, and remember what the fire service does for us. Whenever we need them, they're always there. Thank you. And I'd like to start by thanking also how the first responders have helped us from the very beginning of this pandemic, being individuals and people that always answered the call for us. The healthcare professionals, the medical providers, the volunteers who day in and day out, from the beginning and throughout and now, have been there 100%. We wish to thank them, and we of course thank their families for supporting them in their efforts. They didn't miss a beat. And over the last year, these people, our heroes, have been put to the test under the most grueling of circumstances, as we all know. They've worked hard to keep us all safe, and have time and again risen to the occasion when challenged. Without them, Massachusetts would not be in the position it is today, and we're prepared to continue to fight and combat COVID-19, finishing strong in 2020 and continuing this effort in 2021. Last spring, as healthcare systems across our country buckled under the same set of pressures, here in Massachusetts, we were able to push back and stand up and really did not succumb as other places did because of the partnership, the hard work, the effort, the collaboration, the professionalism, the skill and training and ability and commitment that each of these individuals and this healthcare network and emergency responder network brought to this year. And as we face the second surge, we are all well prepared and grateful, especially to our partners here in Worcester, being the first at this time in the pandemic to set up this field hospital. As many of you know, these are my roots. This is where my family lives, where we started our history here in the Commonwealth, and it's where we are raising our own children. And I, time and time again, just can't express how proud I am to be of Central Massachusetts and of the work and effort the people here in the city of Worcester, including Manager Augustus and Mayor Petty. I want to thank Sandy Dunn and the DCU team and all that are part of this leadership team brought to pushing back COVID-19 this year. They've done an amazing job, and I am very proud of all of them. I just want to also acknowledge Eric Dixon. Eric, he's done an amazing job with all of his team, and I remember a conversation early on, Eric, you said, we're built for this at UMass. We can do this. And he proved that time and time again, and obviously again with the setup of this field hospital. Throughout this pandemic, they've served essential roles, and we are grateful for their commitment and all they've done. I know Secretary Sutters will talk a little bit more in detail about the staffing. I mean, the setup is phenomenal. They incorporated new features. Think of the people through UMass that will come here to give the care to these individuals who are very sick. They're amazing individuals. Secretary Sutters will talk a little bit more about that. And they'll have access to lab services. They'll be able to do on-site chest x-rays and general radiology here. They'll be able to provide oxygen therapy, IV therapy, administer inhalers and nebulizer treatments, among other significant services needed to help these patients get well. They will also equip this field hospital with on-site advanced life support, critical care team transfer capabilities due to the capabilities of Worcester EMS and the UMass Life Flight Services. This field hospital will continue to support our healthcare workers, all of them on the front lines, and provide additional capacity for their treatment. We remain prepared to deploy every resource necessary in our fight against COVID-19, and it just gives us a moment as we open this field hospital to say thank you and to express how grateful we are for these amazing individuals who have stood up for us from the very beginning. And to those at home, knowing that these individuals have answered the call for us, it's just a reminder that they can't do this alone, that everyone has to do their part. And simply out of your own health and protecting others, and out of respect and appreciation for the healthcare front line that has never let us down, we are so grateful. And with that, I want to turn it over to Secretary Sutters.
Good morning, everyone. Governor, Lieutenant Governor, General Keefe, Sam Phillips from EMA, and I'm saving last Dr. Dixon. Before I go into my formal remarks, I just want to, in front of everyone, really give a shout out to Dr. Dixon and the UMass Memorial Hospital staff. last spring when we were establishing field hospitals, on a phone call with all the hospital CEOs, without a hesitation. In fact, I thought he was going to charge through the phone. Dr. Dixon was like, we're in. Whatever it is that the Commonwealth needs, UMass Memorial is in. That is also true for the city of Worcester. This year, when we made the decision that we needed to establish, so that we are completely prepared in the Commonwealth field hospitals, an early morning call to the city manager. And again, it was all in, no hesitation. The DCU was there. There was some complications around some filming, and there was no complications. It's just the kind of, as the Lieutenant Governor has said, it is the kind of thing in Central Mass. It's just this can-do attitude, and whatever it needs, that we will do it. So I want to thank Dr. Dixon, and I do know that on a couple occasions he has given the courage to his counterparts to also step up with us on field hospitals. As Governor Baker indicated, field hospital operations run the gamut. The size and magnitude of these efforts require all hands on deck. The setup of clinical equipment behind you over there is one of many components, but the most critical component of a field hospital is the staffing. Cannot be shipped from storage and put into service when we need them. And right now, this is a call for staffing. The opening of this site provides an opportunity for trained clinicians and healthcare workers and ancillary workers, including social workers, to put their knowledge, compassion, and commitment to work. With this second surge, one of the challenges we face is that it isn't just Massachusetts or the Northeast experiencing a surge. Our entire country is experiencing a surge and a rise in cases and strains on healthcare systems across the United States. We all need many of the same things at the same time, particularly additional health and medical staff. So, I'm looking straight at the cameras. If you have the skills, the ability, the can-do attitude, and have time to work in a hospital, we need you. Now is the time to step up, serve your neighbors, your community, your loved ones, and the Commonwealth. We urge advanced practitioners, nurses, PAs, RNs, certified nurse assistants, doctors, pharmacists, pharmacy techs, respiratory therapists, radiology technologists, social workers, registration representatives, and observation assistants to apply for these positions by visiting umassmemorialresponds.com. I'd like to say that again, umassmemorialresponds.com or lowellgeneralresponds.com to apply for the many opportunities and positions that need to be filled both here in Worcester and our additional field site coming in Lowell later this month. And Eric, as I said to you as we were taking the tour, if I didn't have some other things that are going on right now, I'd be happy to join this extraordinary staff to be a social worker once again. But with that, I will turn this over to my great colleague, Sam Phillips.
Good morning. Thank you, Governor Baker, Lieutenant Governor Polito, Secretary Sutters, Major General Keefe, and Dr. Eric Dixon, and our colleagues from the City of Worcester. Thank you for having me here today and for the support you've given MEMA and all of our partners to accomplish the mission of setting up this field hospital once again. As I said when we announced this effort in mid-November, and noted again today, it takes a small army to lay more than a mile of electrical cable, thousands of more feet of data cable, bring in beds, chairs, lights, showers, bathrooms, laundry trailers, shower trailers, privacy screens, office supplies, trash barrels, fire extinguishers, and even pillows and linens and sheets. I want to briefly thank all of our partners for the tremendous collaboration and the work that went into this successful build-out. Dozens of people, including tradespeople, the National Guard, and UMass Memorial Healthcare staff and our MEMA staff came together over the past few weeks to turn a vast empty space into what you see now. And thank you so much to a few special people. Of course, our partners at UMass Memorial Healthcare, who have once again stepped up and just been a delight to work with. Sandy Dunn and her team at the DCU Center have just been incredible partners and bringing everything to the table to get this work done. and our local partners at the City of Worcester, from the leadership team to my colleagues in emergency management, have been really terrific inside the building and then also on the outside of the structure as well. And our contractor, SLS, has done a lot of work in helping with this build-out. Finally, I want to just acknowledge the MEMA team, particularly our logistics team that staff a warehouse and mobilize the majority of this equipment, and our National Guard partners who were prepared and ready to ship and offload equipment when we needed to build out this site shortly after the governor and the command center decided to stand up this field hospital again. I want to give a special call out to my colleague Brian Rushlow, who's hiding somewhere. He's been our project manager on site. He got a cold call from me one morning saying, "We need you to do this," and I don't think he's really left this facility over the last several weeks. So thank you, Brian, for your leadership in serving as our GC for this project. As we turn over this facility to UMass Memorial, I really just want to personally thank every doctor, nurse, technician, staff member who will work here, and hope you know how much we appreciate everything that you will do and that you've done over the course of this past year. We'll continue to do our part to support your mission in any way we can. And now we direct our attention to our partners in Lowell. Thank you.
Thank you, Governor, Lieutenant Governor, Secretary Sutters. Special thanks to General Keefe and our friends in the Massachusetts National Guard. Couldn't have done it without you the first time. We couldn't have done it without you this time. Thank you. I want to also thank the City of Worcester, City Manager Augustus, Mayor Petty, who didn't think twice when we asked them, can we have the DCU again for a field hospital? They had other business that was here. They were starting to get things going again. They canceled all of this so we could serve this region and the entire state. Let's give special thanks to the citizens of Massachusetts that are following the rules every day. They're staying in when possible. They're wearing their masks. They're social distancing. Then when they do go out, they see people that aren't following the rules. It's because of those people that we have this field hospital going up again. We don't want this to be the second surge. We want this to be the final surge. And it will only be the final surge if everyone follows the rules every day. This is about being a good citizen. This is about taking care of your fellow human being. And that's what we need of you right now. To the caregivers here in the DCU, at UMass Memorial and across this state, who will once again be asked to go above and beyond the call of duty, I'm sorry that you have to, but you know the community, the state, needs you once again. We're going to get through this. We've got vaccines likely to start in the next couple of weeks, and we're going to emerge from this, I believe, stronger than we were in the past for having gone through this together. To Pete, Sharon, and Dr. Broach, who have been here, I don't know how many hours straight at this point. I'm sorry that I had to ask of you to do this once again, but I know you're up for the challenge. So thank you, and thank you to all of you.
Dr. Dixon, could I ask you, I've asked you this before.
Thanks.
Your people have worked so hard, I'm sure they're fatigued. How is morale, number one? And number two, how's this going to affect the normal operations of the UMass Memorial?
So I'll answer the second question first, Jonathan. The moving people here, moving equipment here, moving doctors here, that puts stress back at the medical center and at the rest of our hospitals. And so it is extra work, not only for the folks that are working here, but for everyone at UMass Memorial to be able to do this. That's why, as the Secretary said, UMassMemorialResponse.com. If there's anyone out there, nurse, doctor, respiratory therapist, physical therapist, social worker, we need your help. And we would love to have you here. Just go to the website, upload your resume, and we'll be in touch shortly. Because that's the way we're going to fill all of these beds and be able to use all of this capacity. I think we've done everything we can to take care of our people throughout this, the first surge and throughout this pandemic. And as tired as they are, as I walk the floors, and I'll be over at our testing center right next door right after this, the morale is high because they know that they defeated this once and they know they can defeat it again. And they know that there is amazingly, a vaccine right around the corner. And that's the fastest we've ever been able to produce a vaccine. So they're going to rally once again. They're going to get us through this as they did before, and we love them for it.
Are you cutting back on surgeries and some normal things you would do?
Yeah, we have cut back on some surgeries and some other things, things that can wait. The doctor says this can wait for a month to be done. We're slowing down on those, and that will continue to happen at a greater rate as we start to get busier and busier, because there's no sense that hospitalizations are going to start to fall anytime soon.
Doctor, I know this opens on Sunday. What's the expectation when you'll see people here, when you'll see patients here?
Sunday. Yeah, we have a list of patients that would come over right now if we were open today.
Can you do me a favor and just talk a little bit about how much more service capacity and capability you have here than you had in the spring? Because that has a lot to do with how you'll be able to use this.
Absolutely.
Why you would have patients here literally right away.
I say this because there were a fair amount of people out there who saw what happened to field hospitals earlier this year. Said, oh, not all of them were to capacity or what happened. So
Yeah.
I guess that would be important to calculate it about.
Absolutely. Well, so there's several reasons that they didn't go to capacity last time. The last surge was heavily focused on ICUs, and that took up most of the resources. I think between the homeless side and the acute care side, at our peak, we probably had 125 or so of the beds utilized here out of 200. That's pretty good utilization for a field hospital. Things are different in the treatment of COVID now. We have new therapies, remdesivir, monoclonal antibodies, convalescent plasma. We didn't have that when we were here in the springtime. We also have high flow oxygen, which keeps people from getting intubated. We have built all of those capabilities into this center, and we didn't have that the first time. The other thing that we realized and learned from the first time is that if you're in any hospital with COVID, it's a lonely, lonely experience, right? You're in a room, you don't have anybody else in there with you, your family can't come to visit you, and everybody that comes in is in a mask, a face shield, and in a plastic suit, essentially. And you don't know if you're going to get better or worse. Here at this facility, we took that into account and built it so patients can get up, walk around, be together in an area that's safe, be on a recumbent bicycle and start to exercise, take a shower. There are a lot of amenities here that we can't offer at our hospitals. So, especially our nursing director, Sharon Rudnitsky, wanted to build this out in a way that it was better for a recovering COVID patient than what we can offer today in the hospitals. So that'll certainly make a difference. Please.
Can you expand on the comment you made about people not following the rules leads to places like this opening? And also, could this ultimately be used for the vaccination process?
Yes. So we've all seen it, right? People walking together without masks on, people not keeping their distance. I've been into stores and coffee shops where people I know don't live together are sitting right across the table from one another. And that's a big part of why this center has to open again. And that's a big part of why we're seeing this second and hopefully final surge. And then we've all know the people that are very strict about adhering to the rules. Those are the ones that don't get infected and don't spread. We've got most of the people doing the right thing most of the time, but we need everyone doing the right thing all of the time in order to get this under control and get to the vaccine starting to have an impact on herd immunity. We would not do the vaccine here because the vaccine is for COVID negative individuals, and this is a hot zone throughout. We would do the monoclonal antibody therapy here if necessary. We have an area built out for infusion and pharmacy and compounding, such that if those COVID positive patients need to receive monoclonal antibody, we can do that here. That's very hard to do in a hospital where you're mixing COVID and non-COVID in an infusion center.
If you have seen capacity increase at UMass Memorial since the holidays over the last week?
We are not seeing the impacts of the Thanksgiving holiday yet in the hospital. The actions today impact hospitalizations 3 and 4 weeks from now. So what we'll likely see, and we just don't know how bad, is the positive test rate in the state will rise 5 to 7 days after the Thanksgiving holiday, so that's the end of this week, that's today and beyond, and that hospitalizations could be predicted from that number will rise 3 and 4 weeks out. And so we have definitely not seen, from our perspective, the worst of what we're going to see for hospitalizations.
How understaffed are you? Because I know you're putting out the plea for all of these positions. Can you quantify it? And at some point, do you have to limit who you can bring in here because we don't have the staff?
Right now, today, we're fully staffed at all of our hospitals, and if necessary, we can close some things like outpatient clinics, endoscopy, and redeploy those staff to support areas that need it. Here, we're ready to be staffed for 50 beds probably in the second week of December, 25 on the 1st. It starts to get pretty thin for us, and we'll start to have to stretch out staffing if we don't get some people to respond to that website. And we've got some travelers that were here before that want to come back. They just need to finish out their contracts, their current contracts, and hopefully they'll come and help. So help is hopefully coming. Please. This is primarily a resource for the state of Massachusetts, but if we have extra capacity and if we can help other states, we'll help them as well.
Cases are rising and we're opening up field hospitals, and yet you say we don't need more restrictions. Why?
Well, first of all, we said there'd be a second surge, and we're working with our colleagues in the healthcare community to manage our way through it. We're going to continue to pay attention to the data that's released every day, but the one thing I would say is one day does not make a trend. And I think one of the things that has been true of the fall surge, and I would argue has a lot to do with most of the people doing the right thing most of the time comment that Dr. Dixon made, is if you look at the slope of the line throughout the fall, it's completely different than the slope of the line in the spring. The slope of the line in the spring went like this. I mean, we went from hardly anybody in the hospital to 4,000 COVID patients in the hospital in the space of less than 45 days. We've seen a gradual 2 to 3% increase since Labor Day. At this point, Labor Day was a pretty long time ago. And we've seen a significant increase in cases. I would point out that the case increase is really different than it was in the spring, too. In the spring, 20 to 30% of all of our cases were people over the age of 70. Okay, that number's been about 8% consistently since Labor Day. And in fact, if you look at the data that's on the public daily dashboard that was put out yesterday by the command center, 67% of the cases, the new cases in the past 2 weeks, were people under the age of 50, and 80% of the new cases in the past 2 weeks were people under the age of 60. That has a real impact on both the nature of who gets sick and how they get sick and how they get treated. And I think in some respects, we're going to continue to talk to the healthcare folks and continue to rely on their guidance about what we need to do to support them. And we'll pay attention to the other data. But remember, we've continued to put mechanisms in place throughout the fall based on the public health data. The implementation of the stay-at-home advisory back in the beginning of November absolutely appeared to have an impact on our case growth 2 weeks later, which is what you would have expected to see, as well as the limit on private gatherings. Many communities are no longer in step 2 of phase 3. They're in step 1 because they don't meet the qualifications and the criteria to be in step 2. This is going to be a constant balancing act for us here in Massachusetts, and we get that.
So do you think that big number that we all saw yesterday is related to Thanksgiving, or you're just not ready to see that yet?
It's one day. I mean, we generally speaking have said before that we need to see more than 1 day's worth of data to make conclusions about what's a trend. I do think we're basically 5 to 7 days after the holiday, which was the time frame that Dr. Dixon talked about. But obviously, I think what we want to see is what the next few days look like.
You did say all options remain on the table.
Yeah.
Do you see yourself potentially in those types of numbers into looking at restrictions like what we saw on the West?
we're going to continue to follow the data, and we'll make decisions. And as I said yesterday, we're not going to make decisions that aren't going to give people lead time with respect to how they respond.
Do you have the update on the numbers of doses that we could see middle of the month?
So we're going to file our report or our plan on Friday. Based on the feedback we've gotten from the federal government, we expect, and admittedly, we'll see how this all plays out. The beginning of this will probably be a little lumpy, but we're expecting to see somewhere around 300,000 doses by the end of the calendar year.
Were you on the call today?
No, I was on the call 2 days ago with the Warp Speed Task Force with other governors.
Governor, I know that you're finalizing your application to the federal government, giving them your plan. Can you give us any guidance about whether doctors and nurses should get the doses first, or England says really they should go to nursing homes first? There seems to be a switch there.
I think I'm going to wait until Monday to have that conversation with you folks after we file our plan. The plan is based on a lot of guidance from a pretty important and sophisticated collection of experts in one field or another around the Commonwealth that was led by Paul Bittinger from Mass General. But I think it's reasonable for me to say today that healthcare workers and long-term care folks are absolutely going to be up near the top of the list.
Governor, this actually maybe for Secretary Sutter, but we learned that the mobile testing unit is going to several schools. Just wondering what went into that decision, why that was.
You want to talk about it?
Could you repeat it because of the airflow there? Sorry.
Wondering about the mobile testing unit that was sent to some
Yep.
schools, why they're there, what led to that.
Yeah. So we set up so we have the ability to do mobile testing in response to cluster development. We've done it actually in central Massachusetts around the Fitchburg Church cluster. So we've been doing mobile testing because there was a clear cluster. And so if a school department in concert with their local board of health believe that there is a potential cluster within a school, they can request the mobile testing to come out to the school. Obviously, kids would need to have the parental permission, and then we do testing of staff, teachers, and students if they have their, permission by their families. So, sorry.
Is there a particular concern with clusters at schools now? Is there a particular concern with clusters at schools specifically now? And is it related to development?
No, it's again it's sort of like this field hospital, right? You want to be prepared, and when we set up actually with the National Guard last spring the ability to do mobile testing. If all of us go back in time, the first mobile testing that we did in Massachusetts was for our long-term care facilities, and we initially piloted it with the National Guard, Major General Keith and Colonel White, and that for us created, could we have a mobile testing capacity in response to clusters? And so we continue to do mobile testing for nursing homes, but created that as really a community response when you believe there is a cluster in formation. So it's not exclusive to schools. It is also, we've done it, as I said, in response to the cluster in Fitchburg, the Fitchburg Church. So we've done community testing around the communities in response. We've done it in so many places, it's hard to. So truly, like if you see a cluster in formation, in this sense, a school in concert with the local board of health can make the request, and then we send out the mobile testing. So we think it's a good response for clusters in development.
Secretary, are you expecting that a second field hospital will be necessary or reopening at the seaport in Boston?
So we are planning at this point, this one obviously, the one in Lowell, and we're having conversations in the southeast as to whether we should plan for one down in the south coast area, the southeast area. We're not at this point, at this time, planning on one in Boston.
Governor, how many people's unemployment claims are being held up because of the new ID verification process? What's the timeline on that? When do you think that people take days, weeks to get their employment?
Well, first of all, there are a couple of issues that affect how fast people's unemployment claim gets processed. And the biggest one, believe it or not, is the accuracy of the information that's submitted. And we talked about this back in the spring when we went through this issue. when we had that huge crush of new applications during the first round of COVID. And a lot of people sent stuff to constituent services. A lot of people reached out to the Lieutenant Governor. And to me, we tracked all of those down. And I can tell you, and I'll look right at the camera on this one, in almost every case that we tracked down, the problem was that the wrong information was actually submitted in the first place, and therefore the claim didn't process. And the single biggest issue most of the time was the correct name of the employer. Now, if you work at a Dunkin' Donuts or you work at some other organization that has multiple sites, that organization is loaded into the unemployment system not based on just their main name, but their name plus their location. And if somebody believes that they're having trouble getting their claim processed, the first thing they should do is reach out to their employer and make sure they're actually submitting the right name. That is the single biggest reason that most claims don't pass first time through. Second thing is, we are doing a process of validating both with employers and with individuals whether or not, in fact, they are the person that they say they are. We're sending hard copies, notifying people that a claim has been submitted under their name to make sure that people who haven't submitted a claim actually get this and can let the unemployment folks know that they got a claim and they're not applying for unemployment. But the other piece is to contact the employer. That process takes about a week. It would be hard for me to answer. I could probably give you a range later today on how many, because there's always work in progress on that. But we'll get you an answer on sort of a range of how many people are typically in there at any point in time.
Governor, I understand you obviously deal with a lot of headaches. We obviously listen here every briefing, but what do you hear from the cities and towns about their biggest headaches and their challenges?
I might let the mayor or the city manager speak to that. I do a call with local officials every couple of weeks. The Lieutenant Governor does a couple of calls a week with Mass Municipal and with other local officials. There are a lot of issues that come up on those calls, some of which relate to COVID, but a lot of which relate to other stuff, not surprisingly. And I think I think the biggest challenge most local communities have had throughout this process is not dissimilar to ours, which is coming up with messages and communication strategies to encourage everybody about the importance of playing by the rules. And I think that continues to be, I mean, I agree completely that, you know, most of the people most of the time in Massachusetts, and that's why this surge looks a lot different than the one in the spring. But post-Thanksgiving, it's going to be really important for people to up their game. But why don't you go ahead and speak to that?
I would just echo what the governor said in terms of trying to find fresh ways of bringing the same message back to people, hopefully in ways they absorb it and act on it. A couple of weeks ago, we did a display with red roses, displaying a heart, which is in the center of the city's seal. One for each person who's a resident of the city of Worcester who's died. There were more than 300 roses in that display just to try to make real. There were 300 people, residents of Worcester, who started this year who are not here now going into the holiday season. And that's how real it is for us. There's a lot of families that have been impacted. So trying to get that message out to folks and reinforce it. I think the other challenge as our numbers go up is the contact tracing and keeping up with the contact tracing, giving the volume of numbers and the number of contacts that people have, and trying to make sure we do that in a timely way so it can have the impact that the program's designed to have.
Let me just follow up on that. The one other thing we have worked with a lot of our local colleagues on is making sure we have shelter capacity as the weather gets colder. One of the biggest challenges there is space, right? You can't organize a shelter spatially the same way you organized it before we had COVID. And so we've been literally working one one part of Massachusetts after another to find solutions to make it possible to ensure that we have enough shelter capacity to serve them this winter. Thanks again for coming.
Thanks, everybody.
Thank you, guys.